guys, this is Mini Divan and you're watching HealthSite. And as this week marks the National Eye Donation Fortnight, we have with us today Dr. Harshvardhan Ghorpare, Cornea, Cataract and Refractive Surgeon, Fortis Hiranandani Hospital, Vashi. So as we begin, I think the very first question that I want to ask you is that please share with our viewers what is the significance of this eye donation week, National Eye Donation Fortnight to be precise.
Yeah, so the National Eye Donation Fortnight is celebrated every year from the 25th of August to the 8th of September, and the concept was devised by the government to make people aware about the importance of eye donation. So people in India are in general not very favorable clients for eye donation. We have to actually coax them, we have to inform them and try to make them donate their eyes because they have certain notions about eye donation because of various religious beliefs and other things.
Is there any age limit for eye donation or any set criteria as to who can donate their eyes?
Well, technically speaking, we prefer eyes starting from the age of 2 and up to the age of 75 because these are the corneas which more or less have been formed completely in terms of their quality and the anatomic design of the cornea that is required for donation. However, we don't say no to any corneas. People above 75 also, some of them have got healthy corneas, and people, children below 2 years also can donate. But these corneas are mainly utilized for research and development purpose.
Considering the quality of the cornea as we are discussing, so within how much time of the death of the deceased person can eyes be donated? And is there any set particular guidelines or precautions that the family of the deceased person should keep in mind?
Usually the cornea has to be collected within 6 hours of the death of a person because that is the time when the degeneration of the tissue starts, and we don't want a degenerated cornea for a transplant surgery. At the same time, we advise the relatives to keep the person in a cool place. Maybe the air conditioner can be kept on so that the cornea doesn't degenerate fast. The other thing is that they can keep 2 pillows under the head of the person so it doesn't get swollen up. And thirdly, you can close the eyes of the dead person and place moist cotton or tissue over the eyes so the eye remains moist. We don't want the cornea to get dry.
So what are the usual apprehensions that you've observed in people while donating their eyes, or if at all they plan to donate their eyes?
Yeah, there are many actually, but usually the people feel that the face might get disfigured after the cornea is collected, or some people believe that after death they have another life to live and they need eyes for that second life. So these are few of the common beliefs that people have in our country, and the reason is mainly illiteracy and some of the religious things that they may have read. So I would like to give people the message that we don't remove the entire eyeball nowadays. We just remove the front part, which is the cornea, the transparent part, and a surrounding rim of white tissue around it. And we place an artificial lens in the area that has been removed so that the eye does not look disfigured. And once you close the eyes, you won't even know that a tissue has been removed or a cornea has been removed from that person. So there is no question of disfigurement of the face.
So what are the basic steps and means to pledge for eye donation? Is there any dedicated phone line number?
You can only pledge your eyes before death. It is opposite to kidney transplant, where kidney transplant can be done even during life. Go to any eye bank or eye donation center and tell them that I need to just fill that form, or it's not even a form, you just have to write your name in a register and they note your address, phone number, and they give you a card. That card is just like a license which says that I'm ready for donation if I die somewhere, and you can keep that pledge form. It's a small card with a small pledge at the back saying that I want to donate my eyes after death. There's a helpline number at the back which is the number of the eye bank which has issued the card. Plus there is a national helpline number which is 1919, a simple phone number. You just call them and they will give you the nearest, they connect to the nearest eye bank, and the people from there come and collect the corneas.
Also, please tell our viewers what's the current ratio of eye donation, and are we getting enough eyes being donated for the people in need?
So there are about 2 million people who need corneal transplants, who are corneal blinds. Let me tell you that only the front part of the eye can be donated. The entire eyeball cannot be donated. We don't have a surgery for that as of now. 2 lakh people are being added every year. For some reason or the other, we have firecracker injuries, tuna burns, so many things in our country. And the donations maybe are happening around 50,000 per year only. So around 1.5 lakh deficit every year. And out of those 50,000, around 15,000 are being discarded because the corneas are not of the greatest quality and they may not be used, and they're used for research. So only 35,000 maybe or 40,000 transplants are happening in our country every year.
Also, post the pandemic, has COVID affected the number of transplants? Has the number of transplants, the ratio of number of transplants altogether, has it been affected?
Yeah, definitely. There are a lot of restrictions now put on by the government regards going to someone's house and collecting the corneas, for example. That is no more allowed right now. And we have to, collect it only from a hospital which is a non-COVID hospital. So that is another thing, because if you go in an area where there is COVID, then there is a high chance that the person who was admitted in the hospital may have contracted the disease, and we will be transferring it to the next person. So COVID hospitals, individual residences are not allowed right now, and therefore we are just collecting corneas from people who are in non-COVID hospitals, and they have to actually be a eye collection or eye donation center. So or even if they are not, they can just call us and we can go and collect it from there.
So considering the advancement in science and technology, are there any newer advances when it comes to corneal transplantations?
In the past, we used to only transplant the entire cornea, the full thickness of the corneal tissue. But now we are able to dissect the multiple layers of cornea. The front layer is called as epithelium, the middle layer is stroma, and the inner layer is endothelium. And the surrounding layer are the stem cells. So we are doing 4 different types of transplants today. We can do just that stem cell transplant, for example, in chemical burns. We can do the stromal transplants in people who have got infection only in the front part of the eye. We can do endothelial transplant in people who have got dystrophies, that is damage to the inner layer, or post cataract surgery. Some people, the inner layer gets damaged because of the heat of the surgery and heat generated during the surgery, and therefore we can just replace the inner layer. This is a great advancement actually. So we are using more tissues and more people can be benefited. The other thing that we have now come up with is artificial corneas. Now artificial corneas are basically made up of certain lenses and cylinders, and they are placed in a normal corneal tissue and then attached to the eyes. The third thing is the plastic corneas, which are coming up nowadays, made up of artificial material and also from animal tissue. And some newer advances like liquid corneas are being used to fill up defects in already in patients' cornea. So newer advances are coming up, lots of new things, lamellar surgery, stem cells, and genetic treatment is also one of the on the horizon, and that should be there in another 2 years.
This has been great. Thank you so much, Dr. Harshvardhan, for joining us today. So guys, what are you waiting for? Please go and pledge today for eye donation. And thank you so much once again, Dr. Harshvardhan, for joining us. This was great. And for the rest of you, stay healthy, stay safe.